Hello, I'm Dr. Sal Brotman, a general dentist from Jacksonville, Florida. Currently, I serve as a senior scholar in the Santa Fe group and recently retired as a chief clinical officer of Blue Cross Dental in 7 states. The primary component of that position was to work with physicians and health systems in integrating healthcare. I previously served as chair of Florida Board of Dentistry, and my private practice is in general dentistry and facial pain. I'm also on the faculty of University of Maryland in the Department of Neural and Facial Pain. Today, we'd like to talk about integration of healthcare between medicine and dentistry and other medical specialties. An important component of this is that physicians and nurses often are undereducated in the area of dentistry. Part of what we do in the Santa Fe group and with my previous position is to increase the knowledge by virtue of webinars that are available to other healthcare professionals and grand round lectures that are available to health systems. Through those, we provide additional information. We also have additional assistance through new software that's available through various medical software corporations such as Epic. Epic, for example, has a toggle that allows physicians and their staffs to ask patients about their oral health and their most recent dental visit. We find that this is extremely helpful. We also have worked with hundreds of physicians and determined that their biggest concern about adding additional questions to their patient questionnaire is the length of time involved in physician contact. So what we've done is created workflows for not only physicians, but nurses and pharmacists and physical therapists so that they can better understand what their patient's oral health needs are and have the person who is the most proximal to the patient, which is usually a medical assistant or a nursing assistant, ask the questions for follow-up by the professional. In addition to that, we work closely with dentists to close medical care gaps. This is vitally important because 29 million Americans a year see a dentist but not a physician. We've interviewed hundreds of patients and healthcare professionals as well to determine what they're comfortable with in finding out what a dentist and a dental staff can do to assist the patients in getting the proper medical care. One of the things that we found is that by changing codes that are available, the CDT codes, that dentists will be more likely to perform diagnostic tests and screening exams with patients in various areas. For example, the Indian Health Service has a broad range of screening tests that they do in dental offices for referral to the appropriate medical specialties. For example, in the Indian Health Service, a young person who uses smokeless tobacco would have a smokeless tobacco screening exam, and an older individual, while that examination might not be appropriate, what would be appropriate is a fall risk assessment. So again, we leave this up to the dentist to determine what's appropriate for that individual, their needs, and how to best keep them healthy. Along the way, we also look at blood pressures, pulse oximetry, diabetes with A1C or other methodology. And with these various tests, we create a platform by which dentists make the appropriate referrals to the proper medical specialist. So this is an important component of the work that Santa Fe Group does. We work closely with our other senior scholars and several of the members of the Santa Fe Group in order to improve the overall health of our patients, improve the safety of patient visits in dental offices, and again, close medical care gaps where appropriate. This is Sal Brotman, Senior Scholar on behalf of the Santa Fe Group. Thank you.